Hello, everyone. I'm Dr. Thameem. I'm here with Dr. Kushagra. He's got an amazing rank in this recently conducted INI-CET. So would love to hear from you. Please introduce yourself, tell your name, your college.
Thank you so much, sir. Thank you for your wishes. I am Dr. Kushagra Pandey. I got rank 6 in this November INI-CET entrance examination, and this was my first attempt. I'm in the current internship batch, so I was not eligible for the NEET. So this was my first attempt, and I'm doing my undergraduation from All India Institute of Medical Sciences, New Delhi. Yes, sir. So I'm really thankful to everyone, my parents, to the Almighty, all the entire DBMCI team, all the faculty members, even all the support staff, everyone who are part of
Great.
my journey for this success.
Great. So, Dr. Kushagra, first of all, I think it's amazing getting this kind of a single digit rank with this
Thank
kind
you,
of a
sir.
competition that is there. And I think this sweetness of this result will stay with you for the rest of your life. It'll be a
Yeah,
very
sir.
memorable thing. But at the
Yeah, thank
same
you, sir.
time, I think those who are looking at this interview would definitely, particularly your juniors and all the other students who are, having this goal of cracking into the top institute that is in AIMS and other institutes of national importance. I think they all want to hear your journey as to what is the correct way to prepare and how do you do it?
Yeah, so I think the best way of preparation is like when you enter your medical college, then you be serious. You attend your lectures, your like in the first year, your classes, your practicals, everything. Focus on your profs properly. Then enter your second year, and then after that, in your probably like for me in my third year, a sort of guidance is necessary. So it's always recommended to join a coaching institute and join because you will be guided here for how to approach the exam. You will make your notes. You will have a good teaching which will build your concepts and also help you studying the bigger textbooks and revise your older stuff which you have studied already in your first second year. So for me it was like that. And then gradually you do your preparation, revise those notes gradually, and then follow it up with your test and discussion. Give tests regularly, subject wise tests, then gradually build up to grand tests, and then finally revise those notes in internship, and then just give the exam. Yeah.
Right. So the way you say it looks kind of easy, you got
Yeah,
a
yeah,
set path.
but this is that 5.5 years, that journey
True.
leads to this rank.
True,
Yeah.
true. I think being serious and being committed during undergraduation and right from first year, they're asking questions from
Yeah,
an
sir.
ad physio till final year, they're checking everything.
Yes, sir.
So I think it really pays to be very committed to your studies right from the first year. I think being
Yes, sir.
an Amsonian, I think AIMS, the advantage also you have is everybody around you is very hardworking, very serious, and
Yes,
the whole
sir.
environment
Definitely,
of
sir.
Delhi AIMS is like that. So I
Yes,
think
sir.
that's really great. So what subjects among all these did you find difficult when you were preparing, say about a year back? You must have had in your mind that this 4-5 subjects is where I have to watch out for. So what 4-5 subjects would you say is where you really thought there was an issue and you had to work on it?
So like I found that uh, some subjects which are of too much weightage in the AIMS or INI-CET entrance examination. So I was not that much worried about the short subjects, because I thought that okay, with notes I can do them. And AIMS, either it asks very basic questions in these subjects or it asks two out of the box questions. So we did not worry about those out of the box questions. So my main focus during like around 1.5 years back was on big subjects like if I focus on my 6th to 7th or 8th semester, then it was on big subjects like medicine, surgery, obs and gynae, pediatrics. So pediatrics although carries less weightage, but yeah, definitely medicine, surgery, and obs gynae, they were the main subjects, and PSM of course. So these four subjects, if you have a good grasp in your final year or pre-final year, then definitely it would help you a lot in your internship, because I think pre-para one studies in your first second year. And definitely it's very important to have your patho and pharma strong for a medicine, because half of the almost 3/4 of the medicine I feel can be done from that, and the remaining medicine you have to do from a core medicine. So your patho pharma should be strong, definitely. So yeah, path, pharma, medicine, surgery, obs gynae, and peds and micro. I think these 5-6 subjects, if you're strong in these subjects, then definitely your internship, you won't find a problem in your internship, and you can attempt the you can revise and let's like easily रट्टा मार सकते हो आप बाकी subjects को अपने internship में.
ठीक, ठीक,
Yeah,
ठीक.
definitely.
So there were some questions even in medicine I thought that were
Yeah,
like
sir.
bouncers, like heart failure
Yeah,
percentages they had given, EEG,
yeah,
there
they
was
had
some
given.
vague question. So I think the take-home message is that those questions will not matter ultimately. What
Will
will
not
matter
matter.
is you should not make any silly mistakes on the day of your exam,
Yes, sir.
and you should
Yes, sir.
not lose on easy questions and
Yes,
repeats.
sir. Yeah. So finally, the notes and repeats are the most important. And medicines, I really found, sir, your notes to be very useful. And this year, the questions were in depth in medicine, because usually there's a trend that every year one tells that, okay, medicine is not, we need not focus that much because we have other subjects also in medicine. Usually one has read well in your pre-final final year. But yeah, this year aims make surprises. So that's the thing. This year, the medicine, I think, had a good chunk, and questions were also asked in depth.
Okay.
So yeah, it was important.
But I totally agree with you. I think without second year, final year subjects, obviously in key importance to hai. But as you
Yeah.
mentioned, patho micropharmac is also
Yes,
equally
sir.
important. And
That
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 is
has
the
the,
one that strengthens your final year subjects.
yeah, definitely, sir.
Okay. So how often were you giving the mock exams, the grand tests, the test series?
So, sir, like I started the Bhatia test series, the grand tests I started in my final year itself. So I just gave the test, whatever I didn't used to prepare specifically. I just gave the test, okay, to see where I stand, and it gradually improved. So like in 1 to 1.5 months, I used to give the test initially. Then I increased my frequency to around two to three tests in 1 month, and then I never used to miss any of that INI mocks or GCLTs or any of those tests which are available. I just need to give them because sir, I think that it's not that end preparation which matters the most. If you're prepared well, then you will do good in these GTs only. And in that what I felt when I was giving my first attempt in this exam was that actually not everything comes to your mind. So it's your knowledge which is accumulated. You will see the question, assess them, and then mark them. So yeah, GTs, giving GTs early is definitely of no harm. It's of use only. And uh, yeah, I recommend everyone to give the GTs at
Great.
least for their practice. Yeah.
Great. So, see, getting this kind of rank first attempt is something that is really remarkable.
Thank you, sir.
So, did you get a chance to write the NEET exam?
No, sir, I am in my current internship batch, so I was not eligible for the
Okay.
NEET itself. Yeah.
Okay. So, pehla ball is sixer.
Yeah,
Great.
sir.
Great. Fantastic. So, what important things would you advise your juniors कि ये करो, ये बहुत important है for the exam?
So like subjects or
Anything you feel, whatever comes to your heart, just go ahead.
so first of all, important is like I already said, just be serious, focus on your prof exams. And when you are making your notes from third year or itself, then don't ignore those notes. Don't just focus on a third prof, or like in AIMS we don't have third prof, we have directly the final prof. So don't focus on passing the profs. Study the notes properly, revise them. You'll definitely pass your profs and go score well in them also. It's not the thing. I scored well in all the three of my profs also. So don't ignore the notes, because I feel that when you're completing your final year, your notes should be at least 1 or 2 times they should be revised. So it becomes definitely easy in your internship. And in internship, you have to do a bit less struggle. That I would say only that. So otherwise, in internship, you will have a load of notes to study. So that would be too much. So just keep on revising your notes. And internship, you have to just and revise. Revision is the key, I think. Just revise your notes as many times as you can. And in the end, I think the basic questions and the basic stuff is that matters, not the high-fi things. So just do get them right. And I think 1 or 2 months back, start doing the previous years of aims, or if you're focusing on aims, then NEET. Do the previous years and then go for the exam.
Right. I think the point that you are mentioning that undergraduates should not only focus on the entrance exam, but also the current year and try to get
Yeah,
distinction in the
yeah.
current subject also and prepare
Current
for
subjects
entrance.
also. Yeah,
I think that is the best way. And there are so many students who keep asking, sir, I'm in second year, what should I do? I'm in final year, what should I do? I think this is a very proper technique. Whatever
yeah,
year you are in, focus on those subjects, make sure you make
yeah,
notes, do the MCQs.
yeah. Do the
Right.
MCQ, study your books. Definitely,
That's
that's
the best thing. True.
that's definitely not missing. And you have to read your standard textbooks, UG. And just read them once. I did not have the habit of all the making all the important jotting down all the extra points in the standard books, because I think if you study books like Harrison, and if you start jotting down the important points, then your notes won't be a note anymore. It would be
Textbook.
so I think, yeah, it would be textbook. So I think notes should be very crisp enough. So you have to think of that goal, that you are going to revise these all the subjects around last 15-20 days time. So the note should be that crisp, and you have to just flip it over.
Yeah. So I think you've given a wonderful overview. My one question that I ask all the toppers, what different do you think you did compared to your other classmates and others who are preparing that got you this rank?
Yeah. Different, I would feel that I used to study like initially I didn't think much of the exam. I used to study from like as much as I can. I used to study from either books or notes or anything. I used to study and yeah, just and give GTs. I think for me, giving GTs was the main success, because I think in this aims also I was finding the paper very similar to the Bhatia's GT which I gave, and one or two questions were directly from the GT. So I think, yeah, I was attempting a normal grand test of Bhatia only. So it increased my speed also in the final paper. So yeah, I think GTs made a good difference.
Just out of curiosity, your first grand test you gave, what was your rank in that? And your most recent grand test you gave, what was your rank in that?
Yeah, so I gave my first grand test in around my 8th to 9th semester. I was in, I think I got around, it was GCLT or it was around, I think it was GCLT. So I got around rank 70 or 80 all India rank at that time. And during internship, it gradually improved. And in this, and the latest INI-CET mock of Bhatia, which I gave, I had rank of 1 in that. So
Right.
yeah, it improved from that.
Great, Kushagra. I think huge congratulations to you.
Thank you,
And
sir.
best wishes. And I hope you have a glorious career ahead.
Thank you so much, sir.
Okay.
Thank you very
God
much.
bless you. Okay, then.
Thank you,
Bye.
sir.